Hi everyone, this is Jennifer. I am one of the CMAs for NCCAA Health staff. Today's discussion will be on asthma. We will go over the importance of asthma, signs and symptoms of asthma triggers, and asthma medications. Okay, let's get started. So what is asthma? Asthma is a chronic disease that causes your airways to become inflamed, making it hard to breathe. Some of the signs and symptoms are coughing, wheezing, chest tightness, shortness of breath, and rapid breathing. Asthma is the third ranking cause of hospitalizations for children and one of the leading causes of school absenteeism. A total of 12.8 million school days are missed each year because of asthma. Asthma is a leading serious chronic illness among children. An estimated 22.2 million Americans have asthma. More than a third of them are children under the age of 18. 1 in 11 children have asthma. So what happens during an asthma attack? The lining of the airways swell, causing inflammation. The mucus clogs the airways and the muscles tighten around the airways, causing difficulty in breathing. Frequently asked questions regarding asthma. Can you outgrow asthma? Unfortunately, no. Asthma is a lifelong condition and cannot be outgrown. Asthma can be cured. Asthma cannot be cured, but it can be controlled with medication. If my child has asthma, can my pet get it? No, asthma will not transfer from human to animal. Asthma medications are prescribed for two main reasons. One is to avoid asthma symptoms before they start. Two is to stop asthma symptoms once they have begun. So asthma controller medications prevent asthma episodes. They work by reducing inflammation and relaxing the muscles around the airways. These need to be taken every day, even when feeling well. Asthma quick relief medications are your emergency medications, your rescue inhalers. These relieve symptoms quickly, should always be on hand in case of a flare-up. Can be used when a child first starts to cough, wheeze, and have chest tightness or shortness of breath. You always want to follow the Asthma Action Plan or the IHCP. This medication lasts anywhere from 4 to 6 hours. Why use a spacer with an inhaler? When an inhaler is used alone, the medicine ends up in the mouth, throat, stomach, and lungs. When an inhaler is used with the spacer device, more medication is delivered to the lungs. A diagnosis of asthma is for life, but the disease can be controlled. However, individuals are likely to have asthma flare-ups when they come into contact with their unique triggers. No two cases of asthma are alike. Some people react to just a few of these triggers, some to many. Avoid or limit exposure to known allergens can help prevent asthma symptoms. A trigger is something you are sensitive to that makes your airways become inflamed. This causes swelling, mucus production, and narrowing in your airways. Types of asthma triggers are allergens, irritants, and behaviors. A few examples of allergens are animals, cockroaches, dust mites, mold, pollen, foods, medical conditions. Our pets can sometimes cause asthma attacks due to their saliva and skin flakes. Some examples of irritants: smoke, dust, strong odors, cold weather. Some examples of behaviors: emotions, exercise, and smoking can also be asthma triggers. If a child has asthma, the child must have an IHCP, Individualized Health Care Plan, or an Asthma Action Plan. According to Performance Standard 1302.47B76, the purpose of the IHCP Asthma Action Plan is to ensure that staff are aware of the child's medical condition and have a plan from the child's physician on medical interventions. This is an example of the Individualized Health Care Plan with the health condition listed as asthma. The middle section will be filled out by the child's pediatrician. Every space needs to be filled out. If it does not apply, the physician can write NA, not applicable. It must be signed by the doctor and dated, and also the parent. signature, and date. This is a sample of the asthma action plan. We will go over the green zone, yellow zone, and also the red zone. In the green zone, asthma is under control. There's no symptoms of asthma, no coughing, no wheezing. The child is able to sleep through the night and can participate in all activities. The parents need to assure that their child takes their controller medication daily. In the yellow zone, you will begin to see early warning signs of asthma symptoms. Follow the asthma action plan prescribed by the child's healthcare provider if you notice any of these signs. Anxious look, flared nostrils, fast breathing, shortness of breath, hunched over body position, vomiting due to hyperventilation, restlessness during sleep, persistent cough, irregular breathing, wheezing, not feeling well. In the red zone, you follow your asthma action plan and get help. You need to be prepared. Do not wait until the last minute to learn how to handle an emergency. In case of an emergency, you always call 911. A few things to remember. Do not administer expired medications. Check IHCPs and asthma action plans. Follow doctor's orders. Check the 5 R's: the right child, right medication, right dose, right route, right time, and also right documentation. Make sure that your documentation is thorough. And call 911. In summary, there is no cure for asthma. The best way to manage asthma is to avoid triggers. Take medications to prevent symptoms and prepare to treat asthma episodes when they occur. Remember that if a child takes their asthma medications every day, their asthma will be controlled and they will be able to have an active and fun life with their family and friends. Resources that were used for this presentation are as follows: Asthma and Allergy Foundation of America and the Center for Disease Control and Prevention. Okay, time for post-test questions. Describe 2 asthma triggers. Any of these are acceptable. Animals, strong odors, behaviors, exercise, mold, food, pollen, etc. Number 2, identify 2 signs and symptoms of asthma. Coughing, wheezing, chest tightness, shortness of breath, rapid breathing, any of those are acceptable. True or false? Asthma can be cured with medications. That's going to be false. Asthma cannot be cured with medications, but can be controlled with medication. That concludes this presentation. Thank you so much for watching.